Hello, and welcome to another session of Doc Talk with Dr. Russell Jaffe, owner, founder of Perk Integrative Health, and medical anthropologist and bone health expert, Dr. Susan Brown. And I am Jay Srimani, clinical nutritionist with Perk Integrative Health.
So, Dr. Jaffe, over the years, I've noticed that the Europeans, the individuals dealing with acid-base balance, are very fond of citrate therapy. And in fact, they combine their minerals with citrate in their formulas that they use to alkalize. I kind of wanted to talk about, and we personally use a lot of citrate. Many of the forms that you produce and we use have some citrate in them. But I wanted to contrast this with the new popular idea. People are getting the idea that we should alkalize, and they're jumping to, well, let's do this really cheaply. Let's use sodium bicarbonate. And we know that bicarbonate alkalizes, citrate will alkalize as well as bicarbonate, but that the bicarbonate has other issues, that it tends to dilute the hydrochloric acid in the stomach, for example, and weaken digestion, where citrate won't do that, as I understand. I wanted to discuss this whole concept of jumping to sodium bicarbonate, and why wouldn't we jump? I mean, most people in this country don't need more sodium, but they do need more potassium. Why wouldn't we use potassium citrate or magnesium citrate to alkalize, even for athletes that find that they can benefit from dosing with sodium bicarbonate before their activities?
Well, the headline is that anytime you try to fool Mother Nature, you're fooling yourself.
Yeah, good.
So the bicarbonate therapies were disproven many decades ago. Then that was forgotten. Then they came back and were disproven. And now they're back again and they'll be disproven. Because now we do have to talk about something called mechanism of action. How do things work?
Okay.
As you correctly said, Susan, if you take bicarbonates, A, you're going to impair stomach digestion, and B, more importantly, every human being is endowed with something called carbonic anhydrase. I apologize for being too technical, but carbonic anhydrase is an enzyme catalyst that regulates the bicarbonate and carbon dioxide in your bloodstream.
Mm-hmm.
If the bicarbonate you swallowed got into the body, the carbonic anhydrase would deal with it. No benefit, much harm. So you end up fooling yourself, impairing digestion, and the carbonic anhydrase stays in control. In contrast, the mechanism of action of citrate, like other so-called Krebs salts, Sir Hans Krebs got the Nobel Prize for figuring out it was a cycle and not a linear process. And they include citrate, the tricarboxylic acid, citrate, malate, fumarate, and only a few others.
Mm-hmm.
What you want is to be able to extract the energy using the Krebs energy cycle that can include and benefit from citrates. And that's why, starting in 1987, we included malate, succinate, and citrate in our Lifeguard capsule. It's why we included in the enhanced magnesium uptake the Perk Mag Plus Guard and choline citrate.
Mm-hmm.
We have included enough choline and citrate to correct the deficit of both in humans. So my suggestion is follow the nature, nurture, and wholeness approach that we've been using for the last 33 plus years. And therefore, you take the citrate salts of other things that are helpful, like magnesium citrate or other citrates, and not citric acid, because it turns out that commercial citric acid comes from a place that you don't want it.
Huh.
It's contaminated with toxic metals because the toxic metals are catalysts to produce the commercial citrate that is labeled not for human consumption. But that label was taken off, and it's included in many dietary supplements that I would not take.
And isn't it usually from corn? Citric acid. A lot of the citric acid is from corn.
Yes, unless you get a certified corn antigen-free citrate, you can assume that the citrate comes from corn. with all the problems of the commercial corn. And choline bitartrate doesn't work. Citicoline doesn't work. Many other forms of choline don't work. Choline citrate does work, and a teaspoon of that with 50 milligrams of elemental magnesium will enhance the uptake of the magnesium and correct the choline and the citrate deficiencies in people.
Now, would that be stable? Say we're very fond of taking a dark bottle, putting the fully reduced, fully buffered ascorbate in there, and then drinking it throughout the day. A magnesium, if one were to put a magnesium citrate in there and maybe a choline citrate, would that be stable over a day?
Yes, I can tell you that when I make up my potent C guard in water as the chaser for my supplements, I include a teaspoon or so of choline citrate in that same beverage.
Mm-hmm.
What we recommend is that you get a jogger's bottle. This is something that is closed and you can sip on.
Right.
What you will find is that the ascorbate plus the choline citrate stays glass clear throughout the day.
Okay.
It means it's not oxidized, because as soon as it begins to oxidize, it turns yellow. And if that happens, then you shouldn't take it.
Okay. Okay. So the citrate would be stable, the choline citrate, just like the ascorbate.
Citrate's a very stable molecule. It's one of the building blocks of biology, but it's a very stable molecule.
Right. Great.
Right. Awesome.
And there's really the human body has a great need and a great capacity for dealing with ascorbate, with citrate.
Well,
You can take
again,
several.
as long as you have kidneys, you can
Yeah.
deal with citrate, you can deal with malate and succinate, you can deal with glycinate, you can deal with the minerals, as long as you have kidneys. If
Yes.
your glomerular filtration rate is below 30, we'll have a different conversation, because then your nephrologist will be part of the conversation.
Right. Exactly. The kidneys will always excrete any excess unless they're seriously weakened.
Yeah.
Yes, but to say that as clearly as I know how, if it's water soluble and the minerals are water soluble and the citrate is water soluble, if it's water soluble, it's regulated by your kidneys, your sweat, and your stool.
Right.
That's biology.
X. Thank you.
Thank you.
Now, I understand that young, athletically oriented people are kind of like a flock or a herd. And if something is spoken about and is cheap, they're likely to try it. Now, sodium deficiency, you can actually have a sodium deficiency if you say we're on a keto diet and did a lot of sweating, did a lot of exercise and sweating. But sodium deficiency, you actually have to work hard at, because Americans get too much sodium and too little potassium. So I agree with your point, Susan, that if we're going to give a monovalent mineral, it would be potassium, but not as the bicarbonate. Now, it could be potassium citrate, malate, fumarate.
All right.
But I think it should be part of the mineral family of essential minerals, knowing that as long as you have kidneys, it's water soluble and we regulate it. And therefore, when in doubt, take a little more of the Celtic sea salt or the salt of your choice that is potassium rich and micromineral rich. And I think somewhere, and if we haven't sent it to you, we can, there's a slide that shows that Celtic sea salt has 13% trace minerals, whereas most other sea salts have 1 or 2%. So there's a reason to get fully evaporated seawater, which is what the Celtic sea salt is. And as I'm sure you know, but you don't put that in a salt grinder because it's not ever really crystallized. It's a super saturated solution, and you can pick it up with your little fingers or with your fingers and sprinkle it on your salad, or sprinkle it on your plate, or sprinkle it on what you're going to eat. And boy, it will brighten up the taste of almost anything.
You know, thank you. I hadn't been using that. I'm definitely going to do it.
It's great.
So we want to be careful about trying to fool Mother Nature and fool the body with bicarbonate. There are many harms and very little benefit. There is something called trisalt, which is a potassium and other bicarbonate product to avoid the sodium, but it has the same problem, which is it's bicarbonate.
Right.
Yes, it can suppress certain symptoms, but we're not in the symptom suppressive business. We're in the health promotion, restore vitality business. And therefore, the short-term gain and the long-term harm of bicarbonates needs to be articulated.
Yes, and it's about time we look a little deeper into these supplements and actually focus on the sustainability, on the actually regeneration of health, instead of just some shortcut solution that may alter your pH. I see what you're saying, yeah.
And this is an aside, but it happens to be true. Every one of the doctors who tried to convince me that trisalts were the answer has passed away.
Yeah. Yeah.
Well, thank you. That was great. Yeah, it was a enlightening discussion. Thank you.